Hi guys, and welcome to another video. In this video we're going to learn about how to deal with a stroke. We're going to learn what is a stroke, how does it feels like, how to identify it, and lastly the treatment. Okay, so let's start. Let's start with what is a stroke. A stroke is when the blood flow to part of the brain is obstructed. This can happen from two reasons. One reason is through a rupture of blood vessels that will bleed into the brain. However, a more common reason is when a loose blood clot gets trapped in the blood vessels leading to the brain. A stroke is a very serious issue. Once the blood flow is blocked, the brain cells will soon start to die. And so, in cases like these, every minute matters. When a person experiences a stroke, he'll have some really sudden and noticeable symptoms. Now, these symptoms can come in a lot of different forms. For example, he might feel a sudden numbness in his body. He can feel a tingling sensation or a weakness. And this usually happens in the face, in the arm, and in the leg, especially if it's only in one side of the body. Another one is sudden confusion. The person might suddenly have a really hard time to speak or even to understand language. On top of that, it can be sudden trouble to see. He might not be able to see with one eye or even with both eyes. Another one is trouble walking. The person might suddenly become dizzy. He might lose some of his coordination, some of his balance, which will make walking a lot harder. And lastly, he might get a severe headache that just showed up from nowhere and has no cause, no reason that is apparent to him. Okay, now obviously, if we're watching this from the outside, you're not really going to know if he has a sudden headache, especially if he is having a hard time to speak to you. So, to realize if someone is having a stroke, there's actually a method that is really reliable that is called the FAST method. Now, the reason why it's called the FAST method is, well, first, you want it to be fast. When a person is having a stroke, it is a very, very time-sensitive situation, and we want to be able to recognize immediately if he needs help, and if so, we should alarm help as fast as we can. However, also why it is called fast is because every letter in this method stands for the next step. So let's start with learning about this method, and let's start with the first letter, F. F stands for face drooping. And what does that mean? It means that we want to look at his face and we want to see if one side of his face is asymmetrical to the other one. So for example, it's going to droop. We're going to see some weakness in this side of the face. Now, a very good way to test this is to ask our patient to smile. If we ask our patient to smile and he can only smile with one side of the face, then that is a pretty big indicator that we should call for help. Next is A. It means arm weakness. We want to see if he has feelings in both arms, if he can use both of his arms equally. So we want to see if one arm is maybe more lower than the other, or a very good way to test this as well is to ask him to move his hands, to raise up both of his hands. And if he can only raise one hand and the other one is weak and he's having a lot of trouble, then that too is a very big indicator. Now, S stands for speech. And that basically means that if a patient is having a stroke, in a lot of cases, he's going to suddenly have a really hard time to understand language or to speak by himself. So if we're talking to our patient and we are asking him about all these different things like, can you smile, can you raise your hands, and he is just looking at us, looking confused, then that is also a big indicator. And also the opposite. If he's trying to speak to us and we can't really understand anything that he says, then we should call for help. And that brings me to the last step, T, time to call for help. Again, this is very time sensitive, and that is why if we even see one of these three indicators, we should immediately call for help and wait for the ambulance to get there as fast as it can. This is basically how we recognize and how we treat a stroke. Now guys, I really hope that I didn't scare you, okay? Stroke is a very time-sensitive situation, but I don't want you guys to now go with your daily life thinking about strokes all the time. You don't need to always have this on your mind so you will be able to recognize it really fast. My point is that now that you guys know how to recognize this, you know the signs, you know what to do, I'm pretty confident that you guys will know how to do it. If you didn't know the signs and suddenly someone is talking to you and you can't understand him, or you see a part of his face drooping, you're just gonna be very confused, and it will take you time until you call for help. Now that you guys know how to recognize this, you can be confident that you will be able to deal with the situation a lot better. Okay guys, and that is it for this video. I hope you enjoyed, I hope you'll stay safe, and I'll see you in the next one. Bye guys!